In 2008, the health system decided that it would embark on a recruitment process to recruit more board members that represented the ethnocultural diversity of the community. And as a result, today we have a board that is made up of over 54% of the individuals from these communities, and indeed 40% of our board members are women. And as a result, it really has impacted the way we think about strategic planning, community engagement. We do know, of course, that we've got more work to be done, but I do believe already that we're seeing some really great results from these efforts. The ability for us as a board, for us as a health system, to understand health needs and health outcome differences as it relates to the communities that we serve is particularly important. So having a diverse board allows us to get those messages right at the very top of the organization and those sensitivities to be part of the strategic planning process, to be part of our procedures and our practices. So it has a really significant material impact, not only on our employees, but in terms of the people we serve. And I think ultimately that's very material for any organization. Embracing diversity, embracing equity, embracing inclusion allows you to serve your clients, your population better. The first thing that it means to me, it tells us that we're going in the right direction. I think it's a wonderful signaling device both to us and to other organizations. Often organizations are attempting to embrace considerations of equity, diversity, and inclusion. However, getting an award of this type actually signals to us that we're moving in the right direction. It signals to others that the results are meaningful and are recognized, and it provides a bit of a beacon for organizations to be able to look at some of their policies and some of their strategies to actually progress the interests of living in a diverse society that we call Canada, that we call Ontario. Well, I think there are several factors, but three key factors. One is to have a clear competency measure that includes components and principles of equity, diversity, and inclusion, and to recruit against those measures. I think that's the first one. The second one is to be able to live that mission all the way through. One of the wonderful things done at William Osler Health Systems at the board level is that often we have each month board members talk about how they've lived the mission. And that gives us an opportunity to ask ourselves how we lived the principles of equity, diversity, and inclusion. I think that's very meaningful because it means that not only do we have it as principles, but each of the board members we are each reflecting on how we're doing this and how we're living that vision. The third item, though, I think it's also being very cognizant of the communities that we serve. In the catchment area that's served by William Osler hospital systems or health systems, we serve about 1.3 million individuals each year. And it's also one of the fastest growing regions in Canada and one of the most diverse regions in Canada. So when we take a look at the communities that we serve, we have to be very sensitive to ensure that throughout the whole organization, throughout the DNA of the organization, that we reflect the members of the community that we serve, and that's reflected on the board. I think it makes a significant difference to how we serve the individuals that we attempt to help. So the third one being ensuring as a board that we're reflective of the communities that we serve.